I'm here to introduce Dr. Ellie Campbell, and we're going to get right into the topic about how your dentist and your doctor might work together to help you work out your problems that you may be experiencing with heavy metals. We're going to review why heavy metals are a problem, how you might get tested for that, what they do to your health if you don't address them, and then how can you alleviate your body of these heavy metals. Dr. Ellie Campbell and I work together. We're outside of Atlanta in a suburb, and Dr. Campbell is board certified in family medicine and has been practicing for almost 30 years.
So I thought for our audience today, we would try to talk about maybe 5 things. We want to talk about toxins in today's world. We want to talk about what mercury specifically as a toxin is, where does it come from, and what the impact of mercury is on our health. How we can avoid mercury toxicity and reduce our toxic exposure, and then how to treat it if we find it. And we'll talk about the smart removal technique that dentists use and the chelation that mostly medical doctors are privy to. These are the fish that are highest in mercury. So these are the ones we want to avoid. Pregnant women are told to never eat these during their pregnancy. Shark, swordfish, tilefish, mackerel, marlin, bluefin tuna, or big eye tuna, or anything made with sushi that has tuna in it, and orange roughy. So the others are pretty sort of easy to recognize because they're more darker flesh fish and they're deep water, but orange roughy is a white fish. People don't typically think about that as being high in mercury, but it is. So what if we've determined that you have a metal burden? What if you need treatment? Well, first talk to your doctor or practitioner about daily detoxifiers. So chlorella is a blue-green algae that is known to really attract these heavy metals, which is the favorite food of some of these fish who bioconcentrate it. So that's where they got it from, was the chlorella. But if you consume this, it might turn your poop green, but that's okay. It's a great detoxifier. So is charcoal that Dr. Amy showed you rinse with. If you drank that, it would help you to detoxify heavy metals and other toxicants through your GI tract. Cilantro, the herb that makes salsa taste so delicious, is also a really good detoxifier. And there's another naturally occurring chemical called zeolite. There's many versions of zeolite on the market, but I personally believe that there's one that outshines all the rest, and that's the Zoe brand of clear drops. And the reason why I like that so well is because it's chemically bound to a vitamin C, so this allows it to cross the cell membrane and get inside your cells to clean them up, as well as inside your brain to clean it up, and the other zeolites don't do that. So daily detox is one thing you can do. Another thing you can do is make sure all of your pathways of elimination are open and working. You must poop every day, at least once, 2 or even 3 times. Poop is so important to detoxification. Your urine should be light colored and clear. If it's dark, looks like beer, you are not drinking enough. You want to make sure that you get in a sauna or you sweat through exercise 30 minutes, 3 days a week. I am a big fan of dry skin brushing, of moving the lymphatic tissue towards your lymph glands to help facilitate your lymph ability to clear toxins. Get in a sauna if you like that. Rebound, bouncing on a rebounder, a mini trampoline, or jumping rope to help gravity shake those tissues loose and break up the tissue. A lymphatic massage is another one. And if you're sad, cry if you want to. Tears are another good way to detoxify emotions as well as metals. Next, be sure you're eating enough antioxidants. One of the ways that heavy metals poison us is because they're oxidative stressors. They literally rust our body from the inside, and we can eat anti-rust chemicals in the form of foods, brightly colored fruits and vegetables. Most experts will suggest 6 to 12 servings every single day. Imagine 12 servings of broccoli. That's a lot of food. That's a lot of vegetables. That's a lot of space in your refrigerator. So one way to concentrate them in a food is to make a smoothie. You can put multiple servings of vegetables or fruit in one blender and get a nice serving that's high in antioxidants. And then last but not least, if your level is high enough or your disease burden is great enough, then IV chelation is something that you might want to consider. So what is IV chelation? IV chelation means we start an IV on you and we put something in to take something out. The most common chemicals we use are surfactants like DMSA or DMPS or EDTA, which is a true chelating agent. It looks like a crab claws under a microscope, and those crab claws grab heavy metals and eliminate them through your kidneys, as well as grabs minerals like calcium and magnesium. So every chelation protocol requires that the patient must be taking minerals and multivitamins. IV chelation it does three things. It removes heavy metals, it removes heavy metals, it removes heavy metals. That's all chelation does. IV chelation removes heavy metals. But in doing so, we lower that oxidative stress, and your body now has the capacity to heal. It's not for the faint-hearted. It's a long haul to do IV chelation. It's a minimum of 40 IVs given once a week typically, and they cost between $150 and $250 a piece. So you're talking about an investment of somewhere between $4,000 and $10,000 for a course of IV chelation. Now, it's cheaper than a day in the emergency room. It's way cheaper than a heart attack, which can cost upward of $500,000, but it is not for the faint of heart. And each IV session takes typically 3 hours. So it's a very long commitment, but when you're dying and there's nothing else that can help, if you're toxic with metals, this is an option to know about. What I think is fascinating, I have a colleague named Tony Lamas, and he's a cardiologist in New York and Florida out at Mount Sinai. He's a very famous National Institutes of Health cardiology researcher. He's well known and well respected in his industry, and he had a patient that had angina pains. Dr. Lamas said, "We've done everything you can. You just have to learn with this, to live with this angina. Just don't do anything that makes your chest hurt." He's like, "I walk to the bathroom and my chest hurts. I'm going to do IV chelation. What do you think about that?" And Dr. Lamas said, "That's a crock. Don't waste your money. Don't waste your time. It doesn't do anything. There's no evidence about it." And the patient's like, "Well, my friend did it and it really helped him." So the patient left, and Dr. Lamas said he went home that night and he looked at himself in the mirror and he said, "Why did I say that to that patient? I don't know anything about chelation. I've never studied it. I've never investigated it. I've never looked at it. I've never researched it." So he started going through the literature, and what he found was few and far between, but there was no negatives anywhere in the literature about chelation being bad, and little bits of literature suggesting that it was very good. So he embarked on a 4-year multi-center clinical trial to study thousands of patients and to see what chelation actually did under modern research conditions. And at the end of the study they found that it reduced cardiac events by 51% and cut the chance of dying by 43%. There is no drug on the market that's even 1/10 as good as chelation for this. It was so mind-blowing that they couldn't believe it, and they made him do the study again. So we're currently doing TAC2, a similar version of this study. So chelation saves lives, but there's a lot of doctors who don't understand it and don't believe in it, but the research is now out there.
Thank you for sharing that study, because I personally went through IV chelation for heavy metal troubles. I was also a massive tuna eater all through college, because you could get 3 cans for $1 back then. So I ate it all the time for lunch. It was protein. I thought it was healthy. It was cheap. I could put it in my backpack and eat it over here on the fly. But my point is that chelation is actually really exhausting. So I would recommend, when you do find a chelation doctor, I think it'd be really cool if they can maybe have you chat with some other patients that have been through chelation. It's really tiring. It might be a consideration about when you start your treatment and how much, like Dr. Ellie was saying, takes several hours sometimes for some of the protocols to be done when you undergo that. And when you're doing that regularly, you may have childcare things going on or work things going on. And so it would be really nice, I think, going into it to realize you may need to clear your schedule a little bit, or just take it easy, a little bit easier. I know when I was doing it, this was a number of years ago, I was sitting next to a whole bunch of chemotherapy patients at the same time. And I would have been nice to be able to chat with some more people that were also going through chelation. But I think it's a lot of times people don't realize they would benefit from it, or because they've just never been tested for heavy metal loads. So,
I had a patient that had gangrene on 2 toes. He had such bad circulation from his heavy metal poisoning that his blood vessels basically closed off. He had such bad hardening of the arteries from this. And the pain was so severe that he couldn't even get a bed sheet over the top of his toes. So by the 4th IV, he was able to sleep with blankets. And by the 8th IV, he didn't have any pain anymore. And by the 15th IV, the gangrene on the tips of his toes peeled off like sunburn, and he did not lose his toes. It was the most amazing thing. Dr. Lamas has seen this in his clinic in Florida, too. So even though that's not part of the National Institutes of Health, they're studying heart patients. He, in his own private clinic, is treating patients for peripheral vascular disease in their legs and saving limbs every day that were otherwise threatening amputation from vessel disease. So chelation is a wonderful tool in our armamentarium. It's just because there hasn't been a lot of research on it, it's not covered by insurance. So that's why it costs so much money out of pocket. So we've compiled some resources for your audience. Some are from the EPA and the CDC, the Environmental Working Group, the SMART protocol, the IAOMT website. I'm a member on the board of the International College of Integrative Medicine, and that's where I learned to do chelation. I have a whole website just for chelation. You can read more about it. And then there's a SMART checklist on the IAOMT website. So we're happy to share all those resources with your audience if this has piqued your interest and you want to poke around and learn a little bit more.
I wanted to say something about that EWG website that you have on there, ewg.org. It's great if you want to know about any beauty products and what's in your shampoo or your floor cleaner. So it's not just beauty products, it's all kind of household chemicals. You can go on their website. From there, there's also a link where you can look up, based on your zip code, how many times your local water supply has been cited for failing to have clean water coming out of the tap. So that's a nice little link. It's, you might want to look that up out of curiosity. And what were they found to have?
The Dirty Dozen and Clean 15. So these are the 12 foods every year that are the highest in pesticides. And they're the foods that Americans eat the most of, right? They're the foods that have the greatest pressure for the farmers and grocers to get those foods into market, because those are the foods that people want to eat. So it's things like strawberries and peaches and vegetables like broccoli and kale. So these are highly toxic foods when not grown organically. So you want to do the best you can. Oh, one really interesting thing about kale. Kale is known by farmers to particularly pull heavy metals up out of the ground. So if the ground is too toxic with certain heavy metals, including thallium, the gardeners, the farmers, will plant kale in it to detoxify their soil so it's better for the next crop. There's no regulations against selling that food to the market. So I've seen several cases of thallium toxicity from people who love kale smoothies. And they eat kale every single day, and now they've gotten thallium toxic from that. So we have to, and thallium can kill your kidneys and cause chronic kidney disease. So we want to make sure that you eat kale. It's good for you, but don't eat it every day. Rotate through the different cruciferous vegetables. So sometimes kale, sometimes chard, sometimes spinach. Rotate through them, and always choose organic for those leafy greens.
Thank you. That's a great tip.
This is wonderful. We have a few questions for both of you, actually. So, Dr. Amy, with removing the dental fillings, do patients take a course of antibiotics prior to that procedure?
No. So antibiotics are going to kill the good and the bad flora through your entire gut and all the other microbiomes in your body. We rarely use antibiotics in dentistry nowadays. We really try to instead, when there's a concern about a dental infection, we encourage the patient to go ahead and get treated. We really restrict antibiotic use to when you have a pre-existing heart condition where you need to pre-medicate before dental procedures. For instance, you might have a functional heart murmur, or maybe you've had a joint replacement and You pre-medicate with just one dose of antibiotics about an hour before that dental procedure, particularly if it's a periodontal kind of procedure where there's potentially going to be bleeding. We might offer antibiotics to someone when they have a massive toothache with a fever, but we still reserve some of those we don't give antibiotics for, because if we can go ahead and treat the tooth by getting the infection out, usually that might mean an extraction, you really shouldn't need the antibiotics. If you're on antibiotics for several days, it's going to take you years to restore that gut flora back to about where it was, or it may not actually be ever back to where it was from before.
It will never go back the same.
It takes years and years. So what we realize is we want to live symbiotically with the bacteria. We're not just trying to kill everything. For every 10 bacteria cells in your body, for every 10 bacteria cells in your body, you have one human cell. So there's so many more of them than there are of us, and we live together and they live inside of us. So when you take antibiotics and you kill off all the good and the bad, now it's just a race to see who's going to repopulate you. So no, we don't take antibiotics before we remove amalgams.
Okay.
Unless
Great.
that person has a heart problem, usually, yeah.
Okay, thank you. And Dr. Ellie, what is the youngest age to safely do IV chelation?
Personally, I've never done it to anybody under age 40. There are some pediatricians who will do IV chelation for young children, but usually we can get away with other ways for kids, such as suppositories. We can make DMSA or DMPS suppositories, and usually IV is not required for the kids.
Okay. And there's a few more questions on chelation. Does IV chelation remove good minerals from your body too? Yes, it does.
Now, it's what's called affinity, so it has a higher affinity. It likes lead and cadmium and thallium and mercury more, but it likes calcium and magnesium a little bit too. So that's why it's so important that on non-IV days, you're taking your minerals. It's part of the protocol. We also check blood work periodically throughout, so we're measuring your liver function, your kidney function, your mineral levels, make sure that they stay high. And in our protocol, after every 10th IV, we give you IV minerals. So it's something we're very in tune to, because your listener is exactly right. It does pull out regular minerals besides heavy metals.
Okay, great. And can you quantify the amount of heavy metal removed after the treatment?
So we can do tests, like Dr. Amy said, an oligo scan, a metal analysis, a urine test. I, in my office, usually use either blood or urine, mostly urine. And so we look at the level before and after chelation. And yes, we see the dramatic drop. It's in the red before, and then it goes back down into the green. Now, unfortunately, heavy metals like to live in fatty tissue and bones. Right? Calcium looks a lot like lead. Calcium looks a lot like mercury. So we'll get a heavy metal deposition in our bones. And so what happens is, over time, often 3 years, 5 years, 10 years after your chelation, your level will start to climb back up again. And so you'll have to do another round of chelation or other detoxifying. I have not had zeolite. It's only been available since 2015, this clear drops. So I haven't had a chance to see if that will prevent that problem from happening by taking a daily detoxifier after we're done with your IVs, but I'm very hopeful that that will be the case. So a few dollars a month versus $10,000 is a huge advantage if it's going to work. I'm hopeful that it will.
Okay, and you mentioned some things like cilantro and chlorella. Are those things that are safe for us to do ourselves a little bit here and there, or should we also consult a physician?
Safe for you to do at home. In fact, if you eat orange roughy, shark, tuna fish, I would recommend that you have some salsa on the side with heavy cilantro, or take a couple chlorella capsules for the week or two afterwards. Yes, safe enough to do at home.
I'm going to add to that, the cilantro, they say if you're not a regular eater of cilantro, you might want to consider restricting your serving of cilantro to 1 tablespoon, because it might give you some diarrhea, but it's great. It's really, really good for you. Chlorella makes about 10% of the population nauseous. So the first few times you have it, we don't know if you're one of the 10%, you might want to have it with some other food. I think you'll be able to stomach it better if you're one of those 10%. So maybe in a smoothie.
Okay. And for the cilantro, was that dried or fresh? You were giving them the amount.
I use fresh, but
fresh,
the amount.
Yeah. You would say 1 teaspoon, I think you said?
Tablespoon. 1 tablespoon. 1 big tea. 1 tablespoon.
1 big tea of fresh. Okay, excellent. So those are all of our questions. Is there anything else you wanted to say before we wrap up?
Limit your toxins where you can. Heavy metals are chief among them. So be certain that if you have even the hint that you might have a heavy metal problem, that you find a practitioner you like and trust to assess for it and see if it's a problem.
I do want to say one more thing about the heavy metals. A lot of people aren't tested when they go to their doctor. Their doctor may not be really well versed in the testing, so maybe you consider sharing this video with them or telling them about some of the things you've learned, because that's how sometimes things get to become available at a medical practice is by the ask, the demand. And it's becoming more and more of an ongoing problem. A lot of people have heard about the disaster we've had in Flint, Michigan several years ago with lead toxicity. These heavy metals frequently bind, especially the mercury, it binds to sulfur atoms in your body, which run most of your enzymes and hormone pathways. And so one of the ways you might wonder when we say maybe you're having these heavy metal issues, if you're getting older, but you're just not feeling good, and the other things just aren't adding up. You're being told your thyroid's working okay, but you're just tired all the time. It could be a slow descent to where you just don't feel as good as you used to, and that might be something you haven't looked at before.
Thank you. And thanks to you all, everyone who has joined. You can connect with Dr. Ellie and Dr. Amy in the Know We Well community. You can also find additional educational resources and webinars there. We hope to see you again very soon, even next month, for our next webinar in this series of Healthcare from Your Dentist Chair. Take care, and we'll see you soon.